All right, let's go ahead. We're going to go ahead and get started. There will be some more people hopping in. Feel free to leave us some messages or notes in the chat. And then also we will have Q&A at the end. So also there's a Q&A button. So if you have questions, feel free to drop the questions in the Q&A section. But thank you so much for joining us. Thank you so much to Garrett, Brucker, and the Dextara team for hosting us. Hey, my friends at Clearsight, and hopefully a few of you from Oklahoma City are joining today. I want some fellow Okies on here. And also, thank you so much to Kasey, Gantz, and the Alliance Vision team for being on here and being willing to allow us to take a peek inside of their practice and their operations, and being willing to share their success with us. I won't say secrets because they won't be secrets after today. Being willing to share their success with us. So we all know instinctively that more referrals is a good thing. More patient referrals, more physician referrals. I think sometimes where we get hung up is knowing either how to get those referrals, where to get those referrals, or sometimes just the messaging of the day of, oh, refractive, or people are holding on a little bit more tightly to their wallets. And sometimes those messages can create discouragement or frustration. But the reality is patients still need good care. They're still looking for good care. They're still looking for good providers to provide that care. And so how can we overcome those challenges, and where can we find more of those patients? And when you're building a physician referral network program, I think also too, a lot of times people think that you need a whole bunch of referring doctors, or you need a big percentage of your marketplace to be successful. But I'm going to just pull up a quick little couple of slides here, and we're going to dive into that. PowerPoint's thinking, oh, there it is right there. Okay, so can everybody see my screen? All right, so if you think about it, think about what 5 new referring doctors can mean for your practice. Just 5 doctors. And yes, somebody's asking if this will be recorded. Yes, this is being recorded, so we will be able to share this back. But thinking about what 5 new referring doctors can mean for your practice, you don't have to have everybody in your market referring to you to be successful or to have a successful referral network program. 5 referring doctors sending 5 patients a month equals 25 patients a month. And in the world of eyes, that actually equates to 50 eyes a month. So imagine what 50 eyes can mean for your clinic schedule, can mean for your surgical volume. That can actually be a pretty significant game changer. And then if you think about the potential financial impact of those 5 referring doctors, so those 50 patients, and we're looking at cataract patients here at a national average facility fee of $1,200, a premium lens cost national average of around $3,500, and a very conservative upgrade fee or upgrade percentage of 30%. That can look like a monthly profit of around $100,000 or an annual profit of over $1 million. And that's the potential financial impact of just 5 referring doctors. So it doesn't have to be everyone in your market. It can just be a few people in your market sending you a few patients that can make a really big, really dramatic difference. I think the other thing that we sometimes think is that, oh, in order to do this well, in order to do this successfully, I have to have all the things, I have to have all the bells and whistles. And that's certainly nice to have, but we don't always have to there. And so that's what I really am so excited for Kasey to share with us today. And I'd love to tell you how I first got to know Alliance Vision. So I first learned about Alliance Vision several years ago when they first started. And I was working with a competitor practice, and we started noticing from our data that some of our referral volume was dropping off. And as we started to investigate and the team was looking into what was going on, we learned that Alliance Vision had opened and Dr. Strange was out knocking on doors, shaking hands, and greeting referring doctors. And that impacted our referral volume. And I knew at that point in time that Alliance Vision was going to be a practice to watch. And now in just 7, 8 years. They now have multiple locations, a beautiful, amazing new surgery center. So they definitely have been a practice to watch. And now, Kasey, you have lots of bells and whistles, but I'm guessing that you didn't start with all the bells and whistles. So,
No.
so tell us how you got started. How did you get here?
So since his residency, leaving his residency, we worked together, and he left a group practice knowing he wanted to start his own practice near his hometown here in the DFW Metroplex. And I won't forget the first time in 2016, he said to me what his concept was, and quote unquote, Kasey, this is going to be something different. Let's have a game-changing practice and kind of flip healthcare, on its head and make it very efficient and streamlined and premier patient-focused and experience and service. And I was all about that. I was in a spot where it made sense to me as well. And then he said, and we're going to co-manage. And I was like, okay, no, side note, look up what that is. So, read absolutely everything I could about co-management, and then set off to look for a location that made sense to us. And suggested was the Alliance North Fort Worth corridor. It was, research had shown us that this area was had market saturation of optometrists. There were 40 offices in a 10-mile radius from our original practice location. And then, there was massive city planning and development occurring. They built over 500,000 homes within a year, a lot of industry moving into this market. And then partnered with those two pieces of information, we knew there was no ophthalmologist within that 10 to 15 mile radius of our projected site. So, the timing was perfect for us to hit the market in 2017. We opened, and we had 4 employees: myself, Dr. Strange, his wife Danielle, and 1 technician, Tanya. So the 4 of us kind of set out the strategy to develop what we are today. And in 2018, our patient volume had built to a spot where we brought in a medical optometrist with our office. And that's when Dr. King joined us. At that same time, in the first year and a half, we, focused on trying to find the best surgical facility. It was a little difficult because we were the only ophthalmologist out here. So we knew right then we needed to start developing a plan to have our own ambulatory surgery center and be able to service patients closer and to our practice. And so we strategically started developing that in 2018. And in 2020, we opened a Precision Ambulatory Surgery Center, which was phase 1 of our development plan. And volume continued to build. We went right into planning phase 2, which was building our main practice location attached to that ASC. And we opened that location and moved our original site to the new practice in 2022, July of 2022. And we've just been growing ever since, with a focus on, premium patient care and comprehensive cataract surgery and refractive surgery. And it has been an exceptional 7 years of growth. And we continue to build on that strategy that we started with from day one.
So what do you think, looking back, would you say has been the biggest game changer?
The biggest game changer was for the four of us, I would say in the beginning, you don't know what you don't know, right? And we didn't know a lot in the very beginning. We just knew what we wanted to do, but had really no path. And so we kind of cut our own path along the way. And today and every day, really, we've been exceptionally grateful for network connections like you and Garrett that have added such extreme, efficient ways for us to continue to grow and develop the AVI brand. And the way you guys have done that are by, helping us build a liaison and develop that platform to continue to nurture and support our external OD community, and also, with Garrett and Salesforce to know how we can know what we're missing, which those were things that we didn't know in the beginning. And so those things partnered together were real game changers for us.
Mm-hmm. Nice. So it started out with Dr. Strange, just, knocking on doors, shaking hands. I mean, how did that evolve, and when did you know, okay, it's time for us he's now too busy in the clinic, he's now too busy in surgery, like it's time for us to bring on a physician liaison, or it's time for us to add some help?
Yeah, so his outreach from the beginning actually started before we opened our original location. When we were creating the building during build out, he would work in Waco and then drive back here where he was living and come out to the location and know there were, so many optometrists that he wanted to go meet and schedule those, strategically. And he really was the keystone to building that initial rapport and those relationships with those ODs, and getting our name into the market, and kind of infusing that growth from the beginning. So he planted those seeds, and then Danielle and I, Dr. Strange's wife, and I, about, after the first year or so, he kind of had to scale back his external connections, and kind of let us nurture and take care of those. And we did that to the best of our ability as we grew the practice. Could we have been better? Probably. But, it was very much a grassroots, team. And so we lived that way until for pretty much the first 6 years. And then in 2021, we started to rebrand in ourselves from general ophthalmology to specifically a comprehensive surgical practice. And in that rebranding, there were some key things that we knew we wanted to do. Bring on a liaison was really important because I needed to focus on the development of our oncoming staff, and of the growth that we were about to, take on. And also, Danielle had kind of scaled back her role at that point as well. So 21, we started discussing bringing on a liaison. In early 22, we brought on a full-time physician liaison, and we're very fortunate to find someone that had an ophthalmology background. So she had the educational needs, the communicative needs to be able to have conversations with, partners and eye care. And she just didn't have specifically the resources and the tools to the know-how to get out there in the market and build new relationships and rapport, and then track those, which is where you came in. And we brought you in. You did a 10-week boot camp. I believe it was 10 weeks with Danielle Wood, our current physician liaison. And I would say today she still uses and relies on a lot of those strategies and resources